One of the other things, and we've talked about this with some other treatments, is that, when we're thinking about giving a new therapy to a patient, we always want to balance the risks and benefits. And, obviously this is about, 40% of our patients, variable depending on the group. But how do you counsel patients about immune-related adverse events? And then what is your sort of level of suspicion? Some of these can be hard to pick up, and it does appear to be important to understand them earlier and also consent patients in a way about them. And how do you talk to your patients about that?
Well, I think, the data so far would say that for most people, checkpoint inhibitors are well tolerated with relatively mild toxicities, but in a small subset, the toxicities are quite serious and need to be caught and treated appropriately. And I think those of us who are breast cancer specialists, if you want to use that word, and haven't used a lot of checkpoint inhibitors up until recently, we're learning how to use these. And fortunately, our colleagues in melanoma and thoracic oncology are very experienced with these. And so our group, our breast cancer oncologists, reach out to them all the time for how to manage the various types of toxicities. But I think it's important that patients be aware in that, when a patient and your nursing staff be aware, so that when a patient calls in with diarrhea, it's not just take some Imodium and call me in the morning, that, we think about the possibility this is not just, this is immune related.
Yeah, I think having had a patient recently diagnosed with adrenal insufficiency, or maybe central, because we didn't get an ACTH, but who presented with, feeling lightheaded and weak and tired, which is, your entire practice of patients with metastatic disease who are older. And, this woman weighs about 110 pounds, and so when she got admitted, and they're calling me from the outside hospital about it. Suddenly I was like, oh, wait, can you check a cortisol and do a cortisone stim? She had 0 cortisol. So, it is important for us to keep that really on the top of our mind. It's interesting and can be difficult.